Hi, my name is Jacquelyn Janssen. I'm a nursing student at Mercer University, and today I'm going to be performing a head-to-toe assessment. My clinical instructor is Professor Lance.
I'm Brooke Taylor, and I consent to this video being made and reviewed by Mercer faculty.
All right, so I am in proper PPE. I am going to wash my hands. I'm also going to don clean gloves. I have gathered my supplies and I've organized it at the bedside. The bed is in the lowest position and the brakes are on. The bed is locked, but I am going to raise the bed to a proper working height and position the patient properly into semi-Fowlers. Hi, my name is Jacquelyn Janssen. I'm a nursing student and I'm going to be caring for you today. Could you please verify your name and date of birth?
Yes, Brooke Taylor, 5'11", 95.
Awesome. Hi, Brooke. Today I'm going to be performing a head-to-toe assessment. I'm going to go ahead and close the drapes to maintain privacy. And I wanted to let you know that everything I've learned today is only going to be shared with your healthcare team. Otherwise, it's completely confidential.
Okay.
I'm going to start out by observing the patient's overall survey. The patient does appear to be her stated age. The patient is appropriately dressed in good hygiene and well-groomed. The patient also is proportionate in build, weight, and height. Ms. Taylor, can you please tell me where you are?
Yes, we're in my room.
All right, perfect. And what day of the week is it?
It is Wednesday.
Wednesday. What year is it?
It's 2020.
2020. Patient is alert and oriented to person, place, and time. So, Brooke, how's your day today?
It's been good.
Good. All right. Can you tell me what you had for breakfast today?
I had a big blueberry muffin.
Big blueberry muffin. Awesome. So patient has demonstrated immediate, recent, and remote memory. Patient seems to be comfortable. There's no signs of distress. And patient's speech is clear and coherent. Ms. Taylor, is English your primary language?
It is.
It is. Awesome. All right. Now for pain, observing the facial expressions and nonverbal cues. Patient does not appear to be in any pain. Ms. Taylor, are you in any pain today?
No.
No?
I'm so sorry. I am. I forgot about the pain in my knee.
Pain in your knee. Awesome. Well, not awesome, but okay, the pain in your knee.
I'm glad I remembered.
Yes. Could you please rate your pain on 0 to 10, with 0 being no pain at all and 10 being the worst pain you've ever felt in your life?
It's kind of a 1.
1. Okay. And when did this pain begin?
It started this morning.
This morning. Okay. And does this pain radiate at all?
No.
Could you describe it for me?
It's like a super sharp little pain.
Okay. Is there anything that aggravates your pain?
Walking kind of hurts it.
Walking. And what about what it alleviates your pain?
It feels really good when I put ice on it.
Okay. Alrighty. Well, we'll definitely look more into that after this assessment. But I'm going to go ahead and assess your neurological assessment. So, assessing cranial nerve 3, 4, and 6, I am going to assess your eyelids. There's no signs of swelling or ptosis, as well as your sclera is nice and white, no signs of discoloration. Again, with assessing cranial nerve 3, 4, and 6, I'm going to shine this light at your pupils. Awesome. All right, patient's pupils are round, equal, reactive to light, and they are also accommodating. They're going from 6 millimeters to 3 millimeters. And again, assessing 3, 4, and 6, I'm going to do the 6 fields of gaze. Okay. If you could please follow my pen light, moving just your eyes, not your head. Awesome. All right, patient's eyes, or 6 fields of gaze, are intact and her eyes converge. Next, I'm going to assess her nasal mucosa, or nasal membranes. Awesome. All right, her nose is nice and pink, no drainage. And next, her lips and her oral mucosa. If you could please open your mouth. Awesome. Her lips and oral mucosa is nice and pink and moist. There's no signs of any lesions, sores, or tumors. Next, I'm going to assess cranial nerve 9 and 10. So if you could please open your mouth and say ah.
Ah.
Awesome. All right, her throat, there's no redness. Her uvula rises and falls, and there's no swelling. Again, cranial nerve 9 and 10. Could you please swallow for me? Awesome. Her swallow reflex is intact. Next, I'm going to assess cranial nerve 12. If you could please stick your tongue out and move it side to side. Perfect. Okay, and then if you could please say light, bright, and dynamite.
Light, bright, dynamite.
Perfect. Okay. Next, I am going to assess her respirations. First, I'm going to observe. And are you experiencing any shortness of breath, any chest pain, or difficulty breathing?
I'm not.
No. Okay. I'm going to count the patient's respiration rate, and rhythm for a full minute. All right. Perfect. Patient's respiratory rate is 16. Her respirations are steady. They're unlabored, symmetrical. She has no use of any accessory muscles or nasal flaring. Next, I am going to listen to the patient's breath sounds anteriorly and posteriorly. So if you could please sit up for me.
Sure.
And I'm going to be listening with the diaphragm. Great. And if you could please turn around so I can check them posteriorly. Okay, great. Patient's breath sounds are vesicular without any adventitious sounds. Next, I'm going to listen to the patient's heart valves. I'm going to start with the diaphragm, and first I'm going to go to the aortic valve, which is at the right sternal border and the second intercostal space. Next, the pulmonic valve, which is at the left sternal border, second intercostal space. Next, I'm going to go to the fourth intercostal space, and again, the left sternal border. This is the tricuspid valve. And finally, the fifth intercostal space, left midclavicular line, the mitral valve. And while I'm here at the mitral valve, I'm going to assess the apical pulse for a full minute. Okay, patient's apical pulse is 84 beats per minute. Pulse strength is 2+ in regular, and also there are S1 and S2 were heard. Next, I'm going to re-listen to the valves, but this time I'm going to listen with the bell, starting at the mitral valve, next at the tricuspid, then the pulmonic, and then next the aortic. Okay, perfect. Now, next I'm going to check her neck for any jugular vein distension. All right, perfect. The other way, awesome. So the patient has no sign of any jugular neck vein distension. I'm going to palpate her carotids individually. Okay. Perfect. All right, and then I am going to listen with the bell. If you could please hold your breath while I listen. Okay. Great. All right. The pulse is 2+ and regular and no bruits heard. Next, I am going to observe the patient's abdomen. Her abdomen is flat, symmetrical, no signs of any protrusions, markings, abnormalities of any kind. I am going to listen to the 4 quadrants for bowel sounds. I'm going to be listening to each quadrant for 1 minute with the diaphragm. I'm going to be starting at the right lower quadrant and working in a clockwise rotation. Next, the right upper, the left upper, and then the right lower. Perfect. So, bowel sounds were heard in all 4 quadrants. If there were no bowel sounds present, I would listen to each quadrant for 5 minutes. Next, I'm going to palpate your abdomen. Please let me know if you feel any pain or tenderness. All right, did you feel any pain or tenderness?
No.
Okay, great. So next, I am going to ask about bowel. How often do you have a bowel movement?
About once or twice a day.
Once or twice a day. Okay, and can you tell me about the consistency and color?
It's usually brown and not too hard.
Okay, is there any constipation or diarrhea?
Nope.
No? Okay, and what about how often do you urinate?
I go about once or twice an hour.
Okay, and what's the color?
It's a clearish yellow.
Okay, is there any weird odor or sediment in your urine?
No.
No. Okay, great. Next I'm going to palpate the extremities for the temperature. So the arms, hands, legs, and the feet. Her extremities, they are warm and equal in temperature. Next, I'm going to assess for any edema in her extremities and her face, and patient is without edema. Next, I'm going to check capillary refills, and I'm going to do this bilaterally, all 10 fingers and toes. Perfect. Her capillary refill is normal in less than 3 seconds. Next, I'm going to palpate the pulses bilaterally. I'm going to be starting with the radial pulse. Pulse strength is 2+ and regular. Next, I'm going to be doing the posterior tibial pulse. Pulse strength is 2+ and regular. Finally, the dorsalis pedis pulse. Pulse strength is 2+ and regular. Next, I'm going to observe the patient's skin integrity. Look for any signs of breakdown anteriorly and posteriorly. Anteriorly, there are no signs of breakdown. Could you please roll over for me? Perfect. Okay, posteriorly, there are no signs of breakdown as well. Alrighty. Awesome. And as well, looking at her skin pigmentation, it's consistent, normal for her race, no signs of jaundice, flushing, or erythema. Next, I'm going to check skin turgor. Patient is nice and elastic, no signs of tinting or diaphoresis. I'm also going to check the nails, your fingernails and your toenails. Patient's nails are nice and smooth, they're translucent, they're consistent in color and thickness. Awesome. And her toes as well are smooth, translucent, consistent in color and thickness. And then finally, I'm going to assess your oral mucous membranes again. Okay. If you could please open up. Awesome. Again, there's no redness. They're nice, moist, and pink. Following, I'm going to do a musculoskeletal exam. If you could please sit up and come to the end of the bed here. Sure, I'm in the camera. All right, so I'm going to place my hands on your shoulders. Please try and shrug against the resistance. Awesome. Next, if you could please put your arms like this and pull against me.
Oh, I'm so sorry.
All right, this way and this way. Okay, perfect. And then please squeeze my fingers. Perfect. And then your legs, if you could lift up. Okay, push your legs forward. Pull back. Put your feet up. Awesome. Okay, great. Patient strength is 5 out of 5. Next, I'm going to do the sitting Romberg. If you could please close your eyes, and I'm here for support. Awesome. Now, if you could please stand up.
Okay.
This is the standing Romberg. In the camera. Okay. Close your eyes, please. Not leaning on the bed.
I am so
okay.
sorry.
Close your eyes here for support. Awesome. Okay. Great. You can open your eyes. Patient's balance, sitting and standing, is intact, and it's a negative Romberg test. Next, I'm going to come. If you could come over here, we're going to go ahead and do range of motion.
Okay.
I'm testing cranial nerve 11. Could you please roll your shoulders? Great. And your wrists. And move your fingers, and roll your ankles. Perfect. And then finally, if you could lift your knee, bend your knee and your legs like this, testing your knees and hips.
This is a workout.
Perfect. Patient's joints are quiet, smooth, no signs of crepitus, and her extremities are smooth and controlled. Finally, if you could please walk over to the desk and back. I am checking the patient's gait. Perfect. Awesome. Patient's gait is smooth and controlled.